Now let's discuss about the algorithm during opioid-associated life-threatening emergencies. We all know that opioid intoxication is a very big problem nowadays. The World Health Organization estimates that 27 million people suffer from opioid use disorders. So when we hear about opioid overdose, the first thing is that we think about illicit drugs. But believe me, there is an increasing number that are using prescribed opioids. About 130 Americans die every day from an opioid overdose. So opioid overdose does not just occur only in people who have addictions. It can occur in anyone who takes opioids or has access to opioids. Unintentional overdose can also happen at any time to any person of any age and in any place. Given this information, I want us to be empathetic to everyone. And this is a very serious condition, and it is important to know what to do if you suspect an opioid-associated life-threatening emergency. What are opioids? Opioids are medications used primarily for pain relief. My residency was anesthesiology and ICU care, and of course anesthesiology, we almost every day, not almost every day, we used opioids in our daily practice. And yes, it is sadly, I witnessed that some of the patients who had very long care in the ICU setting had very, very severe fractures and very severe conditions like cancer or metastasis. They become addicted. And the obvious case that I described when I witnessed it was because of the opioids. We used morphine for that patient, and basically we had opioid overdose. So here, of course, very important is the first step, which is safety assessment. We can imagine what kind of situations there can be. And scene assessment is an important tool for identifying whether opioids may be involved in a life-threatening emergency. To evaluate the scene for potential opioid overdose, use these strategies. You need to communicate with bystanders, with people that was there. They may witness something, for friends, families, anyone. We need to ask questions like, do you see anything? Do you have any information what happened? Do you see what happened prior to this signs or unresponsiveness? And of course, we need to know the signs of opioid use. The signs of opioid overdose are slow, shallow, or no breathing, because opioids, especially morphine, is inhibiting the respiratory center. Choking or gurgling sound, drowsiness or loss of consciousness, small constricted pupils. We are saying pinpoint pupils. Blue skin, lips, or nails. Now we assess the safety. We are safe. The patient is unresponsive. We suspect opioid overdose. First step is give naloxone. The drug naloxone can temporarily reverse the effects of respiratory depression that opioids can cause. If available, give naloxone quickly by one of these delivery routes: intramuscular injection, intranasal, or intravenous. Mostly intravenous is given by advanced providers. So there are naloxone autoinjectors. They deliver a single dose via an intramuscular injection. Intranasal naloxone, an easy-to-use device, delivers intranasal naloxone into the nose. So there is no risk of needle stick injuries with this method. The body quickly absorbs intranasal naloxone because the nasal cavity has a relatively large surface of mucous membrane, which is rich with capillaries. And of course, if we have unresponsive patient and we do not have any response after giving naloxone, we need to do all the steps that we discussed for the BLS algorithm for the unresponsive patient. And mostly the patients will be adults, so the depth, the breathing ratios, everything we will do as we do for adults. We can see here the safety, responsiveness, breathing. Then if the victim is not breathing, we will go to the step 4 and we will check the pulse. If there is no pulse, we will do, of course, CPR, AED, and we will give naloxone, and we will do that during the second step too. And this this is ongoing step until a advanced provider or consciousness will come back. And if the pulse, we have pulse, of course we need to support ventilation, open the airway, and do like provide rescue breathing or bag mask device. And of course if we need, we will give again naloxone. And if the victim is breathing, prevent deterioration, try to shout, open the airway and reposition. Again, if we need, you can again give naloxone, and as soon as possible transfer to hospital or call the emergency services. And this is again ongoing. So we will repeat. If it does not work, again repeat until the other advanced providers will come and they will help. So you can give naloxone several times. It's not like if you give one time, you cannot give the second dose.